As you reflected, we have been through an extraordinary journey since January of last year in terms of COVID. We have learnt so much in terms of the treatment of COVID, the prevention measures, the effectiveness of the vaccine. And we're at a stage now, both in terms of Gibraltar and globally, where we need to learn to live with and beyond COVID in terms of trying to protect the health of the population, absolutely, but do that in a safe manner moving forward. Everybody has been so welcoming so far in terms of me starting here, and I'm really delighted to be here and leading the team.
Now you come at a particularly important time. We're on the cusp of the end of summer. Children are returning to schools. The new wave of cold and flu season is upon us, all factors which could contribute to complications for COVID. So how do you see the situation evolving?
So in terms of COVID, we are expecting that the number of cases will start to tick up as the schools go back. Not so much an issue for Gibraltar, but in the UK previously we saw the cases tick up once the university students had gone back as well, for example, which may be an issue for Gibraltar with students coming backwards and forwards here. So I fully expect that the number of cases will go up. Now, just because the number of cases go up does not mean that I need to advise about implementing the more extreme end of the measures. There's 5 factors that I want to look at in the round. Firstly, the number of cases and whether they're going up very rapidly, but in what age group and what are the common factors in terms of the transmission of disease. Secondly, the number of hospitalisations. Sadly, we know a certain number of people will end up hospitalised, but what I want to understand is the demographics of those people. Have they got long-term health conditions? Have they been vaccinated? Sadly, linked to that, thirdly, the factor that I'll be looking at is the number of deaths. You know, Gibraltar has sadly had 97 deaths so far. Every one of those is a tragedy for those families. And we need to understand, learn from that, and look at those in terms of, did the individual die with or from COVID? What was their long-term conditions? What was their vaccination status? Which brings me on to the 4th factor that we'll look at is vaccination. Gibraltar has done so well in terms of the vaccination programme, but what we need to continue to look at is, are the vaccines holding in terms of, are they effective? Which brings me on to the final point of new variants. You know, we are doing so much more global surveillance now, and new variants are important because we need to understand, do they result, as they emerge, do they result in more severe illness, and does our vaccine still work? So those 5 factors, looking ahead into the autumn, just because the number of cases may well start ticking up, doesn't mean that we're automatically going to go into my advice around, we need to have future lockdowns. I'll be looking at those 5 factors in the round.
You mentioned the effectiveness of the vaccine in your last answer. I wanted to pick up on that because there's a lot of talk about booster vaccines being rolled out. Where is Gibraltar with that?
So I think we will be in a position that we can give booster vaccines. Clearly the UK announced today that they were scaling back the numbers in terms of who were going to receive a booster in terms of those who are the most clinically vulnerable in society. I need to understand from the UK the rationale of their decision and their guidance to understand, what does that mean for Gibraltar? What does it make sense for Gibraltar in terms of the population here, and what do we need to do as a result of that? So I'll be working very closely with the vaccine team to look at rollout and delivery of booster vaccines.
You're here for many other things, not just COVID, all things that fall under your remit, but of course COVID is the one issue that everyone wants to talk about. But it's important to mention as well that COVID has given public health and contact tracing a blueprint to deal with other infectious diseases in future.
Yes, absolutely. And I think this is one of the key legacy and learning of COVID is public health. We are the insurance policy people around the world didn't want to have. And unfortunately, COVID has brought that into the spotlight in terms of the rapid expansion of the team that had to happen here. And you're absolutely right, that contact tracing and that taking of a public health history and the management of infections. Yes, we've honed the skills here in terms of COVID, but looking forward and looking into the future, there are many other infectious diseases that we need to continue to keep very close watch on. For example, meningococcal disease, tuberculosis. Infectious diseases have never gone away, and new infectious diseases will emerge at some point in the future. What I need to do with the team here is make sure that we future-proof the public health function so that we are using best use of our resources, but we have a sort of that ability to surge if we need to in terms of responding in the future.